For all those who fought their way through the coronavirus pandemic lockdowns, struggling, but knowing they had to do it, they should be encouraged by the news that the lockdowns prevented 60 million more infections. To put that number in perspective, we're currently inching our way toward 2 million cases total. While it was a pain and uncomfortable to have restaurants, bars, stores, etc., closed, and to work and educate your children at home, it prevented the number from being 62 million and instead of just 2 million. That information was from research that was published on Monday. A separate study from Imperial College London epidemiologists estimated the lockdowns prevented about 3.1 million lives in 11 European countries. Infection rates were dropped by an average of 82%. Both of these studies were published on Monday in the Nature journal. Their approach to obtaining the information was completely different, despite reaching similar determinations. While this all had a massive effect on the economy, it was effective at preventing the virus from spreading exponentially. Without these policies employed, we would have lived through a very different April and May, said Solomon Jiang, director of the Global Policy Laboratory at the University of California at Berkeley. He is also the leader of the research team that surveyed how China, the US, France, Italy, Iran, and South Korea responded to the pandemic. The team estimated that in the first days after the virus was seeded in each country and prior to the shutdowns, the number of COVID-19 infections was doubling every 2 days. The disease was spreading at a really extraordinary rate that is rare even among every infectious diseases, Xiang said in an interview. The response across the world to the virus resulted in saving more lives in a shorter period of time than ever before, he said in a separate conference call with the press. Included with these two reports is a warning that the pandemic is not over, even if the news isn't as bad as it was in the beginning and the shutdowns are beginning to be eased. The majority of people are still susceptible to COVID-19, with only about 3 to 4% of people being studied having been affected, said the senior author of the Imperial College London study, Samir Bhatt. This is just the beginning of the epidemic, we're very far from herd immunity, he said in an email. The risk of a second wave happening if all interventions and precautions are abandoned is very real. The Berkeley study estimated how 1,7171 interventions altered the course of the virus by using an econometric model. Researchers examined the infection rates before and after the social distancing and shutdowns were imposed. The study concluded that 6 countries together managed to prevent 62 million test-confirmed infections. With most people who are infected never following up and getting tested or diagnosed, the number of cases prevented is much higher, approximately 530 million in the 6 countries, according to the researchers' estimates. The study found that timing is crucial. Even a small delay in implementing shutdowns can lead to dramatically different health outcomes. Societies around the world are weighing whether the health benefits of anti-contagion policies are worth their social and economic costs, wrote the Berkeley researchers. While the economic costs are visible, the health benefits aren't because they involve infections that never occurred and deaths that did not happen, said Xiang. School closures did not show much of an effect, but researchers caution that further study is still needed in that area. Yet, the results in the study could become important as school districts consider when to reopen. Some districts are considering a hybrid between online education and traditional education in a school setting within the learning process. The Centers for Disease Control and Prevention last month said schools should remain closed while infection rates are high, but they offered guidance for how to go about reopening. This includes placing desks 6 feet apart and facing the same direction, eating lunch in the classroom, and leaving every other row on buses empty, with staggered arrival times. Cloth masks for staff and students are encouraged as well, along with daily temperature screenings. This goes along with everything being cleaned and disinfected daily. Jennifer Nuzzo, an epidemiologist at the Johns Hopkins Bloomberg School of Public Health's Center for Health Security, explained in an email that these new reports show the effectiveness of lockdowns. But there is also considerable economic and social harms, and societies need to transition to a more focused strategy that has been built around testing, contact tracing, and isolation. Nuzzo stressed, the lockdowns were a pause button, not a cure, adding, any reduction in the occurrence of cases or deaths is temporary. Xiang added, the whole point of this study is to help us understand what we got for this tremendous sacrifice that the country has gone through. Ultimately, whether or not it was worth it is something society has to decide.